There are people who come to our hospital to inquire about thread lifting. First, I look at the patient's face, and among the various treatments they might need, I often prioritize other procedures before thread lifting, because ironing out a crumpled empty bag doesn't make it look much better. It's better to fill in some essential volume first, and then smooth it out. It's better to fill in some essential volume first, and then smooth it out. If the face is hollow and emaciated, pulling it tight won't make it look nice. So, even when doing a lifting treatment, it's better to do the lifting after restoring some basic volume. It looks better that way. If the skin is too thin and loose, it's good to first thicken and toughen the skin with treatments like Sculptra or Thermage. Then thread lifting can be beneficial. If I were greedy and told my patients, thread lifting is absolutely necessary along with other treatments, I would have done about 3 to 4 times more thread lifting cases than now. However, in my view, the effects of thread lifting don't last that long, less than 2 years in my observation. Typically, it lasts from 1.5 to 2 years. Considering the cost, effort, and pain involved in thread lifting, when you think about it, Sculptra offers better value for money. Therefore, I prioritize treatments, suggesting what's most effective and long-lasting for the cost, and what's best for them. As a result, Sculptra usually takes priority. However, there are people whose faces look very heavy, faces that are a bit burdened by weight for injecting anything. For faces that are sagging and loose, I recommend ulthrapy along with thread lifting. You can do them simultaneously, or you can do them sequentially. Either way is fine. Consider if your face is gaunt and your skin wrinkles easily, or if your skin is thick, heavy, and full of volume. It's good to prioritize treatments based on these considerations. It's not good to follow others and get treatments indiscriminately. If a group of people rushes to one clinic following someone's advice, that clinic will likely recommend the same treatment for everyone. Caught up in that atmosphere, spending a lot of money, only to regret it later and come to me saying, I got thread lifting and now my face is sunken. There are quite a few people like this, and there are mainly 2 types of threads used in thread lifting. Threads like Silhouette Soft take about 2 years to dissolve completely, and their effects last for more than 2 years, but clinically, they seem to last about 1.5 to 2 years. I've had thread lifting myself, and it didn't even last 2 years, but the effects were still pretty good. Besides threads made of PLLA like Silhouette Soft, there are threads made of PDO. There are many papers on them now. Korea can be considered almost the leading country in this field, with many cases and research data, but their effects don't last that long, because PDO threads themselves dissolve within 6 months to a year. So, it's good to lower your expectations for thread lifting a bit. You might think thread lifting can do everything, and that tissues will lift adequately when threads are placed, but in reality, they don't lift that much. You should expect about 1/4 of what you imagined. You're just saying that because you're not skilled enough to lift it more, right? You might say, but that's not actually the case. In reality, people who have had thread lifting don't see that much of a lift.